Testing 1 2 3 4. Testing 1 2 3 4. Here's the dock down here, which is similar to the Windows taskbar, and this is the Mcpx icon. Click it, and this is your logon, and you type in your password. And you're in, and if you see a software update window, just cancel it. And in the upper left you'll see 3 buttons, which are the similar buttons to the ones on the PC on the right. The red one will close this window, the yellow one will minimize or hide the window, and then it goes down here in the corner. And this is the most useful one. The green one will expand it to fill the screen or shrink it back down. There's also this arrow up here which gives you a full screen, which takes up everything, so you won't be able to see the top or the bottom when you do it. When you expand it, everything is taken up, and you have to click up here to get back to a normal size screen. Now the top bar here has all the applications that are available here, and the ones that we care about really right now are just the patients and prescriptions, and later on worry about EMR and orders and notes. So the first thing is to, when you open this up, if you're looking for anybody or going to do anything, always go to the patient's application here, or they call it ability. It's the same thing as an application, and then click the window to open it up as big as you can, and we're going to look for Brad Pitt. So you see patients who line up here, and we're going to select Brad Pitt. And if you look up here in the window, so Brad Pitt is now selected. And also, if you look at this little icon here, this means we're only looking at one patient, which would be Brad Pitt. If we wanted to look for a lot of patients, then we'd have to go back to selecting this icon here and then typing in somebody else's name. So we'll go back to Brad Pitt, and we're back to looking at one patient. These are all the windows that are available for each patient. Primary, secondary, and account is all information that we're not going to be entering, so we can just ignore them. The ones we care about are patient, clinical, ledger, and folders. So first off, if you click on the patient window, this information will either need to be entered or will already be in, and we'll go over how to do that in a different screen. You have the demographics up here, and normally when you see someone's new screen, mobile phone is on top of home phone, because this is what we normally use to contact a patient. So you've got last name, first name, and when you enter names, they automatically capitalize, so you don't have to worry about it. Nickname is only used when somebody is either in the Health Professional Recovery Program, which are doctors and nurses, or if it's a patient of mine downtown, and that clinic is called the Eleanor Hutzel Recovery Center. So if you see HPRP or EHRC, those are patients that are seen downtown if it's if it's EHRC, or seen in the regular office if it's HPRP. And we get their SOCH number, which we use for doing prescription searches, and there's a chart number, which we really don't use too much, and then an email address, which we're going to use for the patient portal. Birth date, gender, and when they became a new patient, and that would normally be the first time they were seen in the office, or you may back up to an earlier date if they were seen in the hospital first. This is a kind of useless screen here, but you have pop-ups, reporting, and reminders, which we don't use currently. The pop-ups You need the marital status, whether or not they're employed, and for anybody who's on disability, you would put not employed. Preferred language, and this will always be, relationship to primary will always be self, because we don't have the ability to bridge patients in different accounts here. Relationship to secondary is self. And then the provider will almost always be me or maybe Kathy. The office is always Pain Recovery Solutions. And this fee schedule, meaningful use only, means that we're not billing anybody currently. This is only for Medicare reporting, but we're not sending it to a billing service. Down here, you have another set of windows that are all under patient, and you have follow-ups, insurance, referrals, custom, alerts, appointments, notes, and emergency. All we care about for this screen here is referrals. And you can either be referred by somebody or be referred to somebody. And they don't really explain why, but I was told by the company that the referral by must always be on top. So let's say that they were actually referred to Dr. Brieke, but they were referred by Dr. Malinoff. What we would need to do is to move it up so Dr. Malinoff was on top. So in order for the program to work, the person referring has to be the first one. The date of referral has to be no later than the date of the visit. So this can be a problem. Let's say we saw somebody on October 3rd, but we didn't enter this in the computer until October 10th. So when you actually enter stuff in the computer, you'll put down today's date. This is actually December 22nd. But in that case, if the date of referral is after the date of the visit or the first visit, the program doesn't work. So you have to figure out when the first visit was or when the date this information was entered, and make sure that you don't use the wrong date. Whenever you press T, today's date comes up. And these names all come from a database that's built into Mcpx, and if you double click the name, you can find all the names that I've entered here. So for example, let's say we want to add somebody that we're going to send a patient to. So we're going to add a referral, and we're going to say, okay, I'm going to send this patient to Dr. Archer, and Dr. Archer will appear at the bottom. If I want to send it to Dr. Archer or by Dr. Archer, I would click this. This window here can't be after the date of the visit, whatever the visit was. If it is, it won't work. Okay, so that's it, pretty much it. We don't care about any of these currently. We're not using them in the office. So the second major window after patient is clinical. And this is all the information combined from all the different visits that we have. And the first thing is it tells you incident and view. This is kind of confusing, but an incident is anything that's happened. It can be either be an office visit or calling the patient or putting in a reminder or filling a prescription. But anytime you make a new incident, it gets recorded on the ledger. We'll come back to that. So this patient, Brad Pitt, has had all these incidents, encounters, office visits, and I'm going to select all incidents here. There are three views. There's the clinical view, which is what this is, and then there's two things called CCR and CCD, which is clinical care record and clinical care document. The only reason to use either one of those is for meaningful use. So let's say you're working on the visit and you're going to export it to meaningful use, which we'll come back to. You would click either this or this. And almost all the time we use CCR. And this can be printed off or it can be sent into a file for the patient to use. Again, when you're actually working with a patient, you'd use the clinical view. And we are going to use all history here because we've only been working with patients in this program for a year. And this tells you what procedures were done, what prescriptions were written, what medications they already have, what medications are no longer being used, and notes we'll come back to. The problem list is going to be what we're going to talk about in a second, and then vitals are recorded with each visit. Orders we'll talk about over here. So you go down to the bottom of the screen, and there's more windows built into the clinical window, sorry. And the first one here is problem list. And this is the ICD code and the description and the date that it was entered. And you can also talk about resolved, type, or active, but these aren't used very much. So let's say we've seen Brad Pitt and we decide that Brad Pitt has premenstrual syndrome. So on the day we see him, we click and we add a new problem. And 625.4 is an actual category for PMS, and we click that. And you go down here, and on this date, he was diagnosed with PMS. Now remember, if you're entering this, if we saw him on Wednesday and you're entering it on Friday, you'd have to go back and change this to 12, 20, 12. When you enter this, you don't have to use the slash bars, and you don't have to enter 20. So this date would just be entered as 12, 20, 12, and it fills in. And again, these are all ICD codes. For some reason, Mcpx doesn't use a decimal point, so what we call 278.0 is 27800 on these codes here. And we can modify a code. Let's say that this isn't really panic attacks, but it's anxiety. So I'll double click this and I'll say, okay, instead of being panic attack, let me see what anxiety shows. And it comes up right here. So I changed it from panic attacks to anxiety. And I can go from abdominal pain to chronic pelvic pain. So I can change all these codes if I think there's been a change in diagnosis. And somebody can have opioid dependence, but then if they've been in treatment long enough, it becomes opioid dependence and remission, so I now change that to opioid dependence remission. And again, remember, always look at the date that you entered it. Allergies would either be marked off as no active allergies, or let's say we see him today and he reports that he's allergic to peanuts. So you'll see different choices for peanuts. Just take the most generic one. And now we have an allergy to peanuts. We have a creation date. Again, remember that it shouldn't be after the date of the visit. And you can pick severity if you know it. Otherwise, we just leave it here as mild. And the status should be active. Immunizations we don't deal with. And actually, if you put immunization data in, we actually get in trouble because then we have to send it to Medicare, but since we don't do it, it's not an issue. Vital signs are modified or added with each visit. So let's say he comes to see us today, and it's measured on today's date, 11/12/22, and I'll come back to this, but we have to add an incident to today's date to make sure this works. So we'll come back to this. So on 12/22, he weighed 180 pounds. He was 6'1". His heart rate was 80 and his blood pressure was 110/95. And we save it. The 95 blood pressure triggers an alert telling us it's stage 1 hypertension. And if there's anything in the dictated notes saying that I talked to him about it, etc., then you would say action taken, discussed, or if it wasn't mentioned at all, we would ignore it. Smoking is usually established on the first visit, and let's say somebody is a everyday smoker, it's going to trigger another one, and I try and talk to patients at each and every visit. So I have a tag in here when you type in TCCO, that triggers an alert saying tobacco cessation counseling offered and declined. And patient education we'll talk about later, but we're supposed to give out pamphlets to patients depending upon their diagnosis. And finally, for this first intro, we have ledger. The first time a patient comes in, you automatically set up a visit, okay? The next time they come in for all follow-up visits, we're going to say, okay, we have a new incident today, December 22nd. We have an incident name and an incident type. For these, it's either office visit or new visit or prescription call. And that's really the only ones that we'll be using. Office visit, new visit, or prescription call. So we're going to say that he's an office visit. The incident type is one of these. These are the patients I see who are pregnant downtown. These are the healthcare professionals. These are folks who are being started on buprenorphine. These are new patients, prescription fills, or return patients. So he's a return patient. And then we have somebody who referred him. That's from the previous screen. And that really is all that we need to put into here. And that's about it for this one.